Hi, good afternoon. My name is Garfield Clunie. I'm a physician at Mount Sinai. I'm a maternal fetal medicine specialist at the health system. Black Maternal Health Week is in conjunction with Black Mamas Matter Alliance, and it's a week full of activities that surround awareness, activism, and community building when it comes to maternal mortality. As we know, Black women suffer mortality about 2 to 3 times higher than white women. So the Black Maternal Health Week is a series of events that will look deeper into this phenomenon, and also at the end of the week, hope to come up with some solutions or some potential solutions to study that we can begin to start to decrease this disparate outcome. This week is also a part of the National Minority Health Month, which is something that's put on by the National Institutes of Health and Health Disparities, and they aim to promote health education, early detection, control of disease complications in general, not just maternal diseases, but diseases in general. And their theme this year is Vaccine Ready, which, as we can imagine, coronavirus has been very devastating to the Black and Brown community. And so they aim to educate people this month and get them ready to take their vaccine when their turn comes. Maternal mortality rates for Black women in the United States as compared to other developed countries is quite striking. There was a study that was put out, and of 184 countries, and 184 being the best, the United States was at 129. And so that means there were 55 rungs below the number one country. And for a country that spends a tremendous amount of the GDP on healthcare, this is really something that we have to attack, because there is no reason why there shouldn't be better outcomes in this country. In the study also, they noted that the top three countries were Poland, Norway, and Italy. And the difference between those countries and this country, which may or may not make a difference, is that they have a free national healthcare system. And as you know, in this country, there's been a lot of discussion over multiple years on whether or not this is something that we should incorporate into this country. But maybe a universal health plan may begin to chip away at the disparities that occur in Black and Brown communities. US mortality rates in this country are quite high as compared to other developed countries. And I think one of the biggest reasons is that it could be tied to the social determinants of health. And those include economic stability, education access and quality, healthcare access and quality, neighborhood and the environment, as well as social and community support. As you can see, these are things that affect one's ability to function, to have health, to have education. And so as we try to chip away at the disparate outcomes in healthcare, we do have to look and see how the social determinants of health affect each community. Another thing that plays a role in the high maternal mortality rates is, I think, implicit bias. And implicit bias is a term that was coined back in 1995 by two psychologists, and it really circles around sort of unconscious association and judgments. And what they said was that the brain looks for ways in a very busy environment to sort of normalize things, and so it tries to associate things. And so implicit bias has seemed to come out of that kind of phenomenon. And we're hoping that with the initiatives that are happening throughout the country at medical centers to educate providers on implicit bias will help to decrease maternal disparate outcomes. There are several major complications that account for maternal death. The four top are embolism, hemorrhage, infection, and cardiomyopathy. As you may know, pregnancy is what we call a hypercoagulable state. And so pregnant women are at risk for clots. And so they are assessed by their providers. But unfortunately, for some circumstances, some women aren't able to follow up or take the anticoagulation that they need to take. And this can lead to a terrible outcome, including something as bad as mortality. In terms of hemorrhage, we all heard the term of or the phrase of people having a bleed after pregnancy. There are risk factors that are associated with postpartum hemorrhage, we call it, which could be having multiple pregnancy, meaning twins or triplets, having a lot of fluid in the pregnancy, being in labor for a long time. And so again, having your provider and having that open conversation and knowing what your risks are and how to prevent those would be important. Infection also is another important one because, as you know, with labor, sometimes with the vaginal delivery, there may be tears where infections can be introduced, and there can also be cesarean section where infection can be introduced. And again, engaging with your provider and how your body is feeling and what you think is going on is very important and could potentially save your life. And the last one is cardiomyopathy, which is a big one because that has to do with hypertension. And as we know in the Black and Brown community, hypertension is higher than most other communities. And there's a disease called preeclampsia that can happen in pregnancy. And what we're finding out now is that preeclampsia, although it does resolve after delivery, there can be some long-standing effects on the heart. And so something called a echocardiogram of your heart should be done if you've had preeclampsia, and you should have close follow-up with your provider. So these are some of the top reasons why you really want to be engaged with your provider and follow up when they ask you to follow up. I know it sometimes can be difficult with having a new baby and all the responsibilities that come along with that, and we completely understand. And thank goodness we have video visits now because that does help. But it's very important to follow up with your provider so that you can be treated for any of these disorders that may occur. Decreasing maternal mortality rates is complicated. Every patient is an individual, and everyone who walks through the door, we have to treat them as an individual. Although there are some diseases that people do have in common, depending on how much you weigh or how tall you are or other medical problems you may have, these diseases may manifest differently. And so the American College of OBGYN has tried to sort of balance the playing field by creating some protocols, and it's called the Safe Motherhood Initiative. And they really try to tackle the most common disorders that are associated with maternal mortality. And what they're doing is trying to eliminate that implicit bias that might be there, trying to eliminate that sort of, well, this patient looks like this and she may respond to that, but sort of trying to even the playing field. And these protocols include for hypertension, venous thromboembolism, for sepsis, which is a severe type of infection, and also for obstetric hemorrhage. Um, uh, over the past few years, these protocols have been implemented into multiple hospitals across the country, and they do seem to be helping to decrease the poor outcomes that are happening with pregnant women and Black and Brown women in particular. I think another thing that's happened in New York State is that the governor has put together a task force to look into maternal mortality. And so one of the things that came out of the recommendations from the task force, which I think is interesting, and actually I've thought about this myself in the past. In many of the other developed countries, midwives play a significant role in the labor and delivery and care of the patient. Countries where there is universal health care, there is also universally postpartum leave for the patient. And so patients don't have to worry about going back to work very soon after delivery, so that they can actually pay attention to their bodies and make sure that they are healing correctly and feeling well. And so I think that along with these bundles and along with the task force that the New York State is setting up, I think in the coming years, hopefully sooner than several years, we'll be seeing some decreases in maternal mortality, especially in New York State. But these are initiatives that are going on all across the country. I always tell my patients that pregnancy is a team effort. It's the doctor, which is me, and the patient, which is you. And we have to have open communication, and we have to have education, and we have to ask questions, and we have to follow up. I think one of the most important parts of pregnancy, which really isn't pregnancy, is called preconception care. There are lots of women who are of reproductive age who have several or one or more medical issues such as hypertension or lupus or anemia or diabetes who could benefit from seeing a doctor prior to becoming pregnant so that they can be optimized in terms of being on the right medications, having the diabetes controlled before pregnancy, because that especially is one of the diseases where fetal abnormalities can occur if diabetes is out of control in the beginning of pregnancy. And so I think preconception care is extremely important. I think the other thing that's very important in terms of having a positive birth journey is to talk to your close family and friends that have already delivered to help you sort of navigate what's going to happen as the pregnancy progresses. This will, I think, naturally spark questions that you should bring to your doctor. I think all doctors welcome questions. I welcome them. I think it's great because it shows that you are engaged with your care. And then on the same token, we make a plan of the treatment or the care going forward, and we agree and we understand why it's necessary, and all the questions are answered. The other thing I think is important is the postpartum era, and a lot of you'll hear a lot of studies or articles talking about the fourth trimester, which is the postpartum time, because postpartum, for instance, is the highest time for a woman to develop a clot. It's a time when you can develop hypertensive disease, which you did not have in pregnancy or before pregnancy. And so it's very important, although the postpartum period is a difficult time, getting adjusted to having a new baby and potentially breastfeeding, if that's your choice, can be very difficult. But it also is very important to be engaged with your doctor and follow up as prescribed.